Hello everybody, welcome back to my YouTube channel. Hope everybody is doing fine. So today we are going to look at one of the OSCE procedures in IRH, which is vaginal examination. So vaginal examination is also called pelvic exam, and by definition it is the medical procedure where a health provider inserts a gloved finger or fingers into the vagina in order to check for number one, the cervix, the uterus, and the ovaries, and also for any abnormalities such as tenderness, masses, and also irregularities. Number two, checking for signs of infections like odor, discharges, and also tenderness. Number three, screening for cervical cancer. This is where you have to perform a pap smear to collect cells from the cervix for analysis. So now let's move on to look at the indications for vaginal examination in IRH. So vaginal examination in IRH is indicated for number one, checking for the molding. Under the molding, we are checking for the sutures if they are widely separated, if they are overlapping but reducible, or if they are overlapping but not reducible. Number two, we are checking for the presenting part. Is it vertex or what? Number three, we are identifying the position of this presenting part. Now, is it anterior occiput? Number four, we are checking for the dilatation of the cervix. How many centimeters is the cervix? Number five, we are checking for the effacement. Number six, we are checking for the membranes if they have ruptured or if they are still intact. So, for example, in a scenario whereby you are working in labor ward where Mrs. Warrior, aged 20, prime gravida, is admitted with complaints of lower abdominal pain, vaginal bleeding, and back aches. On examination, the height of fundus was 38 weeks. The fetal heart rate was 136 beats per minute, which is regular, and the woman was having moderate contractions. So vulvar swabbing was already done for you, and in the next 10 minutes, perform vaginal examination to confirm labor. So procedurally, hand washing has to come first before any procedure. You have to start by washing your hands first, then greet the client and introduce yourself. In this case, we are not dealing with a patient, but a client. Explain the procedure to the client and ask for permission. After you've been permitted to do the procedure, you can now ask the client to flex her knees and also open her knees in dorsal position. So you have to also screen for privacy and tell the client not to feel offended as you have screened for privacy. After that, wash your hands and put on surgical gloves. After putting on surgical gloves, inspect and mention the fingers on the vulva. After that, insert or put the two examining fingers in obstetric cream. After putting the two examining fingers in obstetric cream, separate the labia minores using a non-dominant hand. After separating the labia minores, you have to now gently insert the two examining fingers into the vagina in a downward and backward movement. From there, feel for the cervix and mention the effacement and dilatation of the cervix. Mention the status of the membranes after you felt them, if they are intact or if they have ruptured. And you have to also identify the presenting part and mention it, and also identify and mention the position of the presenting part. So after you are done with the identification and you've also mentioned the position of the presenting part, it is also important to assess and mention the adequacy of the pelvis by feeling for the sacropromontory and the prominence of the ischio spine. After that, remove the two examining fingers from the vagina and mention the status of the discharge. From there, wipe the vulva and leave the gland comfortably. After that, thank the client for being cooperative. Inform the client about the findings. Also, after informing the client about the findings, you have to immerse your gloved hands into the 0.5% chlorine solution. After immersing them, remove them by turning them outside. From there, dispose of the gloves in a leak-proof container or a plastic bag. After that, hand wash for the last time, and then document and indicate to report to the ward in charge. Thank you so very much for watching. Remember to subscribe, to like, and share. Thank you. See you some other time.